Knock, knock, knock. Hey, my name's Kiana. I'm going to be your student nurse for today. Today we're going to be doing a head-to-toe assessment. I'm just going to be assessing everything from your head all the way down to your toes if there's any area of concern. And if you feel uncomfortable or anything like that, just let me know. And do you have any questions before we start?
No, thank you.
Hey, sweet. And so I've gathered all my stuff and supplies beforehand. Hygiene. And first, can you please state your name and date of birth?
Yes, A.B. Holmes, 3/24/2000.
Sweet. Okay, I checked that matched that in your chart before I entered the room. So first, you already told me your name and date of birth. Can you tell me where we're at?
Yes, in the SU nursing lab.
Sweet. And then can you tell me what day it is?
Today's Friday.
Sweet. And then can you tell me what we're doing?
We are doing a head-to-toe assessment.
Sweet. And so general survey seems pretty well. Posture is erect, and patient level of consciousness is good. Appears well nourished. Skin is appropriate for ethnicity. Yeah, they appear clean. They don't feel like they're in any signs of distress. And speech is good. Affect and behavior is good as well. So I'm just going to be assessing your skin now. From what I can see, your skin appears normal. I don't see any lesions or any bumps or bruises and anything like that. And next, I'm just going to palpate and check the temperature of the skin, which seems okay. Okay, temperature is even throughout. And then I'm just also gonna check your skin turgor, which is to assess if you're dehydrated or hydrated or not. And it's pretty brisk, so you're pretty hydrated, which is good. And then I'm just also gonna palpate your nails, and they're even, they're at a good angle, and there's no clubbing noted. And I'm also just gonna check cap refill. And cap refill's pretty good too. Next, I'm just gonna be assessing your head and face. So right now, I'm just gonna palpate your head. And let me know if you have any pain or tenderness while I'm doing this. And it feels good. Okay. So hair is evenly distributed. Hair color looks fine. And then there was no lesions or masses that I felt, which is good. And then your head and posture seems to be good, which is good too. And next, I'm just gonna palpate your temporal mandibular joint. So I'm just gonna feel right here and have you just open your mouth. Okay. And I'll also be assessing your cranial nerve 5. Close. Sweet, so TMJ is fine. There's no clicking or tenderness. There was no tenderness when I did that right now. Sweet, and then cranial nerve 5 seems to be fine as well. And next, I'm just gonna palpate your lymph nodes, just around like your head and neck, and let me know if you feel any tenderness while I'm doing that, okay? Okay. I have your pre-auricle, post-auricle, occipital, your tonsillar, your submandibular, and then your submental. Any tenderness when I did that? Perfect. Okay, sweet. And next, I'm just gonna have you close your eyes. I'm just gonna test your sensory feelings. Okay. Okay. And tell me if you feel it and where you feel it. Okay.
My forehead, right cheek, left cheek, nose, chin.
Perfect. And next, I'm gonna assess your cranial nerve 7. So can you smile, frown, raise your eyebrows? Can you puff out your cheeks and stick out your tongue? Perfect, and your cranial nerve 7 looks fine. Next, we're going to be assessing your eyes. So, first off, I'm just going to pull down your lids and just inspect your eyes, okay? Okay. Sclera is white, and then your conjunctiva is pink. I don't see any jaundice or anything like that. Lashes are evenly distributed, and of course, your eyes are symmetric. Next, I'm just going to assess your cranial nerve 2. Which is just seeing how you can see from close up and from the distance. Okay. So can you read what that bottle says?
Yes, hand sanitizer.
Sweet. And then can you read that white paper over there?
Pharmacy and supplies.
Sweet, perfect. And then I'm just gonna assess Perla. So I'm just gonna see right now your eyes are equal. And then I'm just gonna shine a bright light. And if it hurts, I apologize.
Okay.
Okay, sweet. And then your eyes are reactive to light, which is good. And then I'm just gonna have you follow my finger from here to your nose, okay?
All right.
And then back. And your eyes accommodate as well. And then I'm gonna assess your cranial nerves 3, 4, and 6, which is just to see if there's any extraocular eye movement. Okay. So just follow my finger, just not with your head, just with your eyes only, okay?
Okay.
Sweet, that looks good. So next I'm just gonna inspect your ears. I'm just gonna palpate it and let me know if you have any pain or any tenderness as I'm doing that.
Nope.
Sweet, that's good. And then I'm just gonna also see if there's anything abnormal out here. Just inspect with the light real quick. Nothing, any hearing problems lately or nothing like that?
No. Hearing's good.
Good. And then I'm just gonna test your hearing next, okay? So just tell me what side you hear it on, okay?
Okay.
Right. Left. Good. And then next, I'm just gonna assess your nose as well. So I'm just gonna look at it. Nose is even. There's no drainage or any cuts or bruises or anything like that. And then I'm just gonna have you close one of your nostrils and just breathe in, and then other way. And patency seems well over there too. So next, we're gonna be inspecting your mouth and throat. So I'm just gonna look. Your lips look fine. I'm just gonna shine a light in your mouth as well. Oral mucosa is pink and moist. All teeth are present and appears to have good oral hygiene. And then next, I'm just gonna have you just take a swallow of like your saliva. Good. Any trouble doing that?
No.
Okay, sweet. And then next, I'm just gonna have you stick out your tongue, and then can you move it side to side? Sweet. Any trouble doing that?
No.
Okay. Cranial nerves 9, 10, and 12 are intact. Next, I'm just going to be inspecting your neck. So your neck seems to be is midline, and then your trachea as well as midline as well. There's no masses, and I don't see any pulsations or any JVD like that, which is good. And next, I'm just going to test your range of motion. So can you move your head in a circle? Good. And then left to right. Good. And now I'm just going to have you shrug your shoulders real quick. Good. And then I'm going to have you push against it, so push up. Good. And then when you're turning, try to push against that force, okay? Good. Good. I'm going to inspect the back side of your lungs and the end of your spine as well. So as I can see from right now, the way you're breathing is equal and it's symmetric, which is good. And I'm just going to move over to the back, okay? Okay. So right now, I'm just going to see if your breathing is equal. Okay, take a deep breath. Good. I was just palpating for chest excursion, so it was equal, which is good. And now I'm just gonna have you say the word 99 as I'm seeing if there's any vibration. 99, good. 99, 99, good. And then I'm just gonna percuss your lung fields and let me know if there's any tightness or pain in that as well, okay? Okay. Okay, was there any pain?
No.
Okay, as I was percussing, I heard resonance throughout, which is good. And next, I'm just gonna assess for CVA tenderness. It's just where around your kidneys. Okay. Let me know if you feel any pain, okay? Any pain?
No
Anything
pain.
like that? Good. Now I'm just gonna listen, or before I listen, I'm just gonna see your spine. There's no curvature. Is there any tenderness as I'm going down here?
No.
That's good. And then can you hyperextend your neck up, which is good, and then down. And then can you rotate side to side?
Like this?
Yeah.
Okay.
Sorry. Yeah, range of motion is fine. And now I'm just gonna listen to your lungs, okay? Okay, and then just take a deep breath anytime it's need to do so, okay? Okay. Good. Lung sounds were clear throughout. I'm gonna listen to everything. I'm just gonna do the same thing that I did on the front and the back to the front. So I'm just gonna listen to your lungs. Okay. Deep breath in. Deep breath. Okay. Lung sounds are clear throughout as well. I'm also just gonna listen to your heart as well, and then when I'm done with that, I'm just gonna listen to your apical pulse for 1 minute, okay?
Okay.
So, aortic, pulmonic, herbs, tricuspid, and then mitral. Okay, heart sounds sounded good. There was no S1, there was an S1, S2 in there. I didn't hear any murmuring. And now I'm just gonna listen to your pulse for a minute, okay? Okay. Your apical pulse was 90, which was good. Okay, Amy, next I'm just gonna inspect your abdomen. So from what I can see from here, you're sitting flat, rounded, and symmetric, and I don't see any visual pulsations. And next I'm just gonna listen to your bowel sounds, okay? I heard some bowel sounds, which is good, and they were active in all 4 quadrants. And next, I'm just gonna percuss. I'm just gonna tap lightly, listen for some resonance. Okay. Resonance was heard throughout, which is good. And next, I'm just gonna palpate. I'm gonna go from light to deep, and let me know if there's any tenderness or pain when I'm doing that. Okay. Maybe pain? Is it okay if I relieve her? Yes. Anything else with that? No. Okay, good. I'm just gonna assess. I'm gonna do the same thing that I did on your uppers, but this time it's on your lower extremities. Okay. So I'm just gonna assess your muscle strength. So can you push your legs up against the force? Good. And now lift my legs. I mean lift my arms. Sorry. Good. And then push against it. Good. And then push up. Good. Range of motion in your knees and your ankles are okay. Strength was also equal. And next I'm just gonna assess your pedal pulses. Okay. So I have your pedal pulses here. I like your assessing it down here. And they're equal. I don't know. And now I'm just gonna assess your posterior tibial, which is just behind your ankles. Very good. But I'm just gonna assess your capillary refill. And then next, I'm just gonna assess your deep tendon reflexes, but this time it's your patellar, which is just the knee one, and then the Achilles, which is just behind your ankle, okay? Good. Now I'm just gonna do this one. And then you can just put your shoes back on. Thank you. And then I'm just gonna have you just stand up and then just walk. Good, and walk back. Good, everything is balanced. And then can you just stand on your toes and on your heels? Good, okay, and you're allowed to sit back down. But yeah, that completes our head to toe assessment. Do you have any?
Sweet.
Yeah. Oh, that's. I mean, everything was normal. And did you have any questions or anything?
No, thank you for doing a good job.
Okay. Thank you so much for trusting me.
Yes.